Moving on to the topic our minds are deeply troubled with, COVID-19, yet today from a digital perspective. I'm very curious to learn what message Bernardo Marino, Director Digital Health and Innovation and the Chief Information Officer at World Health Organization WHO in Geneva has for us. He is responsible for setting WHO's strategy of health in the digital age. Mr. Mariano, please share your views with us. Lessons to learn during the corona pandemic.
Thank you. Thank you for having me here. And the pandemic is teaching us all a lesson in many fronts. But on the digital front, one of the lessons that at the World Health Organization that we had to brace and survive this pandemic, in addition to the epidemiological side, was the infodemics, as we call it. Actually, we created a science called infodemics, and we brought a number of scientists to discuss the infodemics. But within the infodemics, there is the whole cybersecurity element. We all know, and I think we all read in many media, both social media and mainstream media, how much healthcare organizations suffered from cybersecurity attacks. And we were not the exception. The World Health Organization saw a dramatic increase of attacks to the organization itself, on digital assets, but also to the individuals in the organizations, especially the leadership and people that with influence in the organization. So there was a lot of that, and we have seen as well in whole healthcare sector, hospitals suffered cyber attacks as they were fighting the pandemic, which was not something that anyone expected before the pandemic. Nobody expected that while we are fighting a global pandemic, we had to fight cyber attacks in such an increasing way. But in addition to this increase of cyber attacks, what we saw as well was this blurred line between work environment, a protected environment at the workplace, and the extension of that workplace with the teleworking, which then required us to actually look at the office, not just from the perspective of bricks and mortar, like the building where people come and sit down in their offices, but the office became where people were sitting at their homes. And cybersecurity and security perspective had to be extended to the teleworking environment of staff, colleagues that were working in those environments. According to the Healthcare Information Management System Society, they did a survey. The healthcare organization experienced this increase of incidents, phishing attacks by 57%. And in social engineering attacks by a number, I think, of multiple folds. And phishing remains the top incident security. And at WHO, we had to extend that protection to ensure that even the private accounts, email accounts, social media accounts of a number of WHO staff were protected, to ensure that the penetration to WHO didn't take place through those social medias and private accounts. We had to shut down old systems, legacy systems that were vulnerable to attacks. We had actually we suffered impact on performance of some of the work and then the collaborations that we have with a number of universities during the pandemic, because some of our legacy systems had to really be shut down because they were compromised because of the cyber attacks. Luckily, before the pandemic, we had already a cybersecurity roadmap, which we had planned to implement in 4 years. We had to implement that, the cybersecurity roadmap. We had to to accelerate the implementation, and basically the plan of 4 years had to be implemented within 1.5 years. But just to show that while before we had over three incidents a month, we started having 3 incidents a day of cybersecurity. So that increase required us to actually change the plan, accelerate the plan, and make sure that the systems remain protected. But we couldn't do that alone. And that's the message that I bring here. Because the cybersecurity attacks, or the cyber attacks, do not happen because one individual is sitting down somewhere doing it alone. They work in a very coordinated fashion. They have groups, they learn from each other. They look at the vulnerabilities, pass on to others, and then exploit those vulnerabilities. So we had to also ensure that we work well coordinated with other entities. And I have to say a huge thank to at least 6 member states, 6 countries that helped us from the cybersecurity perspective, giving us early warning alerts. We had 3 major companies, private companies, that helped us, giving us early warning alerts. We had the pro bono engagements to give us tools to ensure that we were ready to respond, to protect the digital assets of the World Health Organization. To say that, all this is to say that for us to address the cybersecurity in a comprehensive way, for us to ensure that we remain ahead of this cyber war, we need to work better and well coordinated, better than the hackers. We need to share experience, knowledge, ensure that what the private sector knows about how it operates, how countries' cybersecurity entities are able to provide intelligence. This all to make sure, it has to be brought together to ensure that as a community, we protect what is important to us today, which is data. Data is perhaps the new gold in the new digital age. If we think about the gold rush today, if you think of data where it's highly monetized, this is where we need to make sure that efforts to protect it pays off in terms of using it, looking at data as an asset. So the pandemic showed that increased of attacks. It exposed the vulnerabilities. It reminded us that personal security, cybersecurity, and professional cybersecurity, it's very intertwined. So 4 areas that we need to work together. One is the governance, the other one is prevention, the third one is detection, and the fourth one, which is all equally important, is response and recovery. So WHO, we went through all these areas in terms of strengthening governance, strengthening prevention, making sure that we're able to identify and detect attacks as they happen. The most important is, if it happens, we're able to respond and recover very quickly. So that was and the team to support that had to be increased substantially. And the story I'm telling you about how we had to basically increase the response, accelerate the implementation of cybersecurity, I think is the same story that you will find in many healthcare entities, be hospital, be ministries of health, and others that were involved in addressing and fighting this pandemic, where the COVID-19 became suddenly a target from many hackers, either looking for data, looking for vaccines or data, any type of data that they could sell or monetize, or just compromise security. So in WHO, is from this pandemic, and the lessons that we learned is that partnering with computer emergency response team of countries is key, and we continue to do that. Partnering with the private sector is key. We continue to do that. Ensuring that we have a detection mechanism, teams that are constantly look at what are the vulnerability inside the WHO is key. So the ethical hackers, that's the other group I want to be very thankful for. The ethical hackers, some of them helped us to alerted us of areas of exposure that the organization had, and allowed us to take preventive measures. Of course, investment in technology, tools, systems, training, it was key, because as my cybersecurity, the chief information security officer says, he says that the most vulnerable element in the whole cybersecurity ecosystem are people, because we people either use weak passwords or share or click on links, and of course the hackers try to leverage on this vulnerability of people that click on different links to actually to be able to access systems. To prevent that, intense training and retraining is mandatory at the World Health Assembly. So within this governance mechanism and then the prevention elements, in addition to tools, processes, but people training is those are some of the areas that we invested substantially to ensure that the experience we learned, the experience we had, the lessons we learned, and the investment we made puts us into the next level of security protection of WHO, where the data of a lot of member states sits in terms of data that they share with us to provide to the whole world the situation of the pandemic in this case, but also where the data and the private data of the staff members is hosted by the organization, and as well as the data of the entities we interact with, be non-state actors such as universities, is sitting. So we have the responsibility to protect, and to do that, we had to increase that investment, making sure that we build that collaboration. But the key word here is, how can we as entities, be it private, public, or academia, or even civil society, how can we ensure that we build systems and to protect the asset which is the data, which is in digital world? This is the gold in the physical world. So how can we protect the data assets to ensure that we do not have that repeated again? Now, some measures that I want to just give you to dive into a bit more detail is that we prior pandemic, we didn't have a security operating center, for instance. So we had to build that during the pandemic and accelerate that. We had to ensure that we have a red team and we have a threat intelligence solutions to alert us way upfront on potential threats and also other risks that we're exposed to. So this combination of people trained, people skills, and processes, which includes governance and ways to alert each other, but also technology, where the combination of these three areas, people, process, and technology, is what allowed us to move from the cybersecurity stand we had prior to the pandemic, which was, I would say, very low, to an acceptable level. Are we at the level where we want to be? No, we are not. We still have work to do, and we still need a lot more collaboration support from a number of entities that are out there. And we have to take the lessons of today to do better tomorrow. And that's where that collaboration that in partnership is key. So we are open to that partnership to ensure that this digital transformation of health happens in a way that lives are not lives are protected. So we want to bring that collaboration to make sure that we all.
Thank you, Bernardo. Thank you so much for this wonderful talk and for the view from the World Health Organization. It's been a privilege to have you in the conference, and I would very much thank you for making yourself available on this very important perspective. Thank you for joining, Bernardo. It's been a privilege to have you.
Thank you. So I look forward to that collaboration to make sure that we all remain protected from cybersecurity.
Definitely see you next February here in Munich in person again. That's what we all hope. Thank you for joining. Thank you. Goodbye.
Goodbye.